हाय एवरीवन, दिस इज डॉक्टर सौरभ मल्होत्रा एंड आज हम लोग बात करेंगे लिकोप्लेकिया एंड ओरल लाइकन प्लैनस के बारे में. वी विल see how to differentiate these two lesions, how to diagnose and how to treat both. So what is leukoplakia? Leukoplakia is nothing but a white patch that cannot be scraped off. Means अगर आप इसको scrape करेंगे तो वो scrape नहीं हो पाएगा. And lichen planus, lichen means tremors and planus means flat. So it is a chronic inflammatory autoimmune condition that affects the skin, oral mucosa, genital mucosa, scalp and nails. So coming to the etiology कि ये होता कैसे है. On the left side the picture is of leukoplakia and on the right side the picture is of oral lichen planus. The main etiological factor for leukoplakia is smoking. Smoking cigars, smoking cigarette, alcohol consumption. This is the main factors that can cause leukoplakia. About lichen planus, the etiological factor remains the stress in females and it is also linked with hepatitis C virus. The patients with lichen planus, they are more likely to test positive for hepatitis C virus. And the positive factors, they are the allergies to the metals, the caps that patients has of. It's also been linked with the lichen planus. And according to recent studies, COVID-19 virus and its vaccination is also linked with the occurrence of lichen planus. So now coming to the clinical features of leukoplakia. Leukoplakia occurs as a thin, smooth or thick white to translucent to gray to blackish soft flat plaques that occurs on the buccal mucosa, even on the alveolar ridge, even it can happen on the tongue, on the soft palate. And leukoplakia occurs mostly in patients with smokers that consumes alcohol also with. There's a typical appearance of leukoplakia that is called as cracked mud appearance, like mud that has cracks in it. It looks like same as that of cracked mud appearance. Sometimes it is also associated with candidiasis. In that case, it can be scraped off. So there is homogeneous and non-homogeneous type of leukoplakia. Homogeneous leukoplakia is like a plaque that are predominantly white, gray or blackish in color. It can be thin or it can be thick also. They have a smooth, wrinkled or corrugated surfaces with a consistent texture throughout. And the non-homogeneous, it contains speckled leukoplakia, nodular, varicose. If you want to see a case of proliferative varicose carcinoma, I have put a link, or you can see on the right side of the screen. You can click in this link and you can get that link of this proliferative varicose carcinoma that I have done. Coming to the oral lichen planus, it occurs as a white lacy lines or crisscross lines that occurs on the buccal mucosa, tongue, hard palate, soft palate, or anywhere in the buccal mucosa, which is called as Vicum striae. In many cases, patients are unaware of their oral condition, but in many cases, patient complains of roughness of the lining of the mucosa, sensitivity of the mucosa to hot or spicy food. There is painful oral mucosa, or if they have seen these red and white lines in the oral mucosa, so they come to the doctor for the same. लाइक इसमें पेशेंट थोड़ा सा भी नमक भी लेगा, अगर उसको सिम्टोमेटिक होगा तो पेशेंट नमक भी नहीं ज़्यादा ले पाता. पेशेंट्स में थोड़ी सी मिर्ची भी नहीं खा पाता है, वो बोलता है मुझे बहुत ज़्यादा मिर्ची लग रही है मेरे मुंह के अंदर, थोड़ा भी नमक खाता हूँ तो वो भी लगता है. तो दीज आर द मेन कंप्लेंट्स व्हेन पेशेंट कम्स टू यू फॉर दिस ओरल lichen planus. So coming to the 6 P's of lichen planus, these are planar, papule, polygonal, purple, plaque and rhotic. So you must be heard a lot of times that what is the basic lesion of lichen planus. So if you know, please let me know in the comment section, or if you don't know then also let me know. I will explain this to you. Most of the times in patients with leukoplakia, this benign condition occurs, which is known as smoker's palate. It occurs as a small red spots that can be seen on the hard palate, and they are usually asymptomatic. Why it happens? It because of the heat and the chemical irritation that happens because of the smoking, which leads to the tissue inflammation, hyperplasia and keratinization of that area. So and also smokers melanosis. What is melanosis? It is just a melanin pigmentation with mostly the grayish black pigmentation that occurs because of the smoke on the buccal mucosa in heavy smokers. So these are the two conditions that occurs in patients with leukoplakia. And can you please tell me what's the other name of smoker's palate? Can you please tell me in the comment section? And also, most of the times in oral lichen planus patients, desquamative gingivitis cases has also been seen on the marginal gingiva of the patient. And I have not, discussed about non-homogeneous leukoplakia or erythroplakia or speckled leukoplakia and other types of erosive lichen planus and plaque type of lichen planus, because this video it has become already long. So if you want to know or if you want to discuss about this, please let me know. I will make another video for that. So coming to the differential diagnosis of leukoplakia, as you can see here, these are all my clinical cases. Number 1 and 2 is leukoedema. So how to differentiate between leukoplakia and leukoedema? So as you can see on the picture 1, this is the milky white translucent appearance, which is mostly occurs bilaterally and gives a folded appearance. But on the second picture, you can see this milky white translucency that is present on the right buccal mucosa. On the first picture, it goes away when I have stretched the mucosa. You can see here on the clinical picture number 2. There is no milky white appearance now can be seen on this buccal mucosa. So this is the first differential diagnosis is leukoedema. So picture third is lichen planus, as we have already read about lichen planus and we have discussed about the clinical features. So this is a typical Wickham striae or crisscross lines that you can see on the left side on the lateral part of the tongue. And coming to the other differential diagnosis, the other is chemical burn. As you can see on the fourth clinical picture, you can see that white or yellow that layer is formed on that buccal mucosa and the sulcus area, but this can be scraped off. But leukoplakia, it cannot be scraped off. As you can see in the picture number 5, I have scraped that pseudomembranous slough that we call to chemical burn, so it has come off. So this is the other differential diagnosis. The sixth one is the morsiocassiobuccarum, which occurs mostly on the at the level of the occlusal plane. So this is also not scrapable, but this is mostly present on the at the level of occlusal plane, and as the typical appearance of cracked mud of leukoplakia cannot be seen here, and the patient is a non-smoker and patient also doesn't use gutka or doesn't have alcohol also. Now let's discuss the differential diagnosis of lichen planus. So the first picture is of lichenoid reaction. For lichenoid reaction to occur, there should be some allergic component that has to be present inside the mouth. Like in this case, this is a metal crowns that are present on the left side of the molars, and because it is in constant touch with the buccal mucosa, the allergic reaction erupts and it has formed lichenoid reactions. It doesn't have to be bilaterally always, but if the crowns or any allergic metals that are present inside the mouth bilaterally, then it can happen bilaterally. The other is bilateral, means it mostly occurs bilaterally, and most of the times it is asymptomatic also. But yeah, most of the times this lichen planus it occurs bilaterally. Other coming to the fourth, that is mucous membrane pemphigoid. The fourth picture is of mucous membrane pemphigoid, and uh, it forms typical bullae and then it ruptures and forms vesicles. Then there has to be other clinical features, so there's no criss. Then coming to the other differential diagnosis is mucous membrane pemphigoid. As you can see in the picture number 4, it forms bullae, it forms vesicles that ruptures, and there's no crisscross white lines that are present on the buccal mucosa or gums or anywhere where it's happening. And the other one is the leukoplakia that we have just discussed, the typical cracked mud appearance. The patient should be smoker. There should be, or there will be melanosis present. There will be smoker's palate also in that patient. So it's quite easy to differentiate this with the lichen planus. So now coming to the treatment of these lesions, I will share the treatment that I have given to my patients, and you will see the pre and post clinical pictures of the lesions. So this is the treatment for leukoplakia that I have given to my patient. This is the case of speckled leukoplakia, and you can see here this erythematous part on that leukoplakia also, and you can see the other picture. This erythematous part has gone and there's pigmentation that has started This is known as post-impigmentation when this lesion starts to get healed up. And this is the treatment that we have given to this patient. This is a session of habit, and this gel to be applied on the lesion, and this multivitamin capsules, and a bit of lifestyle changes. And after around 1.5 to 2 months, the patient has come with this healed lesion. So now coming to the lichen planus, I have treated a lot of patients with lichen planus, and this is my case that I have treated recently. You can see here, this is the reticular lichen planus, and you can see beautiful striations on that portion of the tongue also. So what treatment we have given is, we have started with the steroid application on that area, and because it was present on the tongue, so application was not possible for the patient, so we have started with the 12-day course of lichen planus. You can see here, I have written the details, the 12-day course here, so you can note it down. This is very much important to give this course to the patient, and after 12 days patient will start having food also, and the lesion will start getting healed up. So this is the other side of the tongue. You can see here the lesion also healed on that side also. And there is a very important rule: if you give steroids to the patient, you should be knowing the rule of two. You can note it down. This is very much important for your, if you have to practice, then this is very much important for you to remember this rule of two. And always remember that whenever you prescribe steroids to the patient, the dose should be lowered in a tapering manner. You should not stop it suddenly. It should be tapered, and then it should be stopped, because you have to remember rule of two for the steroids. So these are the cases that I have done, and if you have any doubt, please let me know in the comment section. I have a lot of treated cases. If you want to know, if you want to see the clinical pictures of that, or if you have any doubt regarding these two, please let me know. Reach out to me in the comment section, or reach out to me in my Instagram page also, which is known as Divinayak Smile Makeovers, and please let me know. I will surely help you out. Thank you.